All right. Good evening, everyone. Good evening, and welcome to the grand finale of our breastfeeding week for 2025. How have you been? I hope you've been learning a lot. We've started in the 1st of August. As we all know, every year, the 1st to the last 7th day of August, we celebrate the breastfeeding week every year. And so, an ATP, as one of the foremost champion for breastfeeding, we always like to talk about breastfeeding. And so today we're just having what look like the grand finale. And so welcome everyone. So today we're going to be talking about breastfeeding again. And so, but before we start, I just want you to share the video, share the link, and let's make sure everybody can see us, they can hear us. Instagram people, I can see you. Welcome. Welcome to. So I'm also just going to share the video myself and pin it in all our groups, and after that we can start. So we've been talking a lot about breastfeeding. I hope you were following us all along. But if you have not, well, you are still welcome today. And if you have any questions on breastfeeding, feel free to ask the question, and then we're going to start. So just give me a minute to get the video and start. Okay, I'm not sure why I can't see the video. Okay, all right. So let me just. All right, so just let me share the video and then we can start. Um, welcome. If you're joining us, welcome. This is a special webinar on breastfeeding. This is the last part of our breastfeeding week program. So I just want to make sure we are all aware of breastfeeding. All right. Let me share. Let me share to WhatsApp. Okay, so I think I'm just going to I'm going to pin it to our groups and then okay, let me just copy it. Okay, so and let me just make sure I share it and I pin it on our. Okay. Um, Let me make sure it is pinned on our pages. Okay. Welcome everyone. Welcome. If you have any questions still on breastfeeding, you're welcome to drop your question. So we'll do that. And I also saw that a lot of us were asking for us to mark the quiz, even though I think you should be able to get the feedback the way we've done it now. But we'll try and do that as well, so that some of you are having issues with some of the answers on the quiz. We also try and do that. So, but I'm just trying to pin the videos so that everybody can see. So, welcome everyone. Um, okay, so okay, let me just share. Okay. All right. I think I'm done with all the sharing. Okay, and I think I'm done with all that. Okay, so welcome everyone to. No, I've not pinned it in the some groups. I've not yet pinned it there. Let me just pin it in those groups. The pin to featured and ATP family as well. Okay, yeah, I think I've done ATP family and ATP proper. Okay, good. All right. So, good evening again, everyone, and welcome to another webinar on breastfeeding. I think for the whole of this week, we've been talking breastfeeding. We did the webinar with the Pediatric Association of Nigeria on Saturday, 5 p.m. On Zoom, and I think quite a lot of us were there. I don't know whether some people may not be there, but it was a lovely, lovely time when we talked a lot about breastfeeding, and we also had opportunity to answer questions on breastfeeding. So if you have any questions still on breastfeeding, feel free to ask. And the question is, why do we talk a lot about breastfeeding? Good evening. Oh, somebody's joining us from from YouTube, Rosemary Elias. Thank you so much. I'm always excited when it's people from YouTube. I know Facebook people are more. All right. So good evening. Thank you so much for joining us. We've been talking about breastfeeding, and breastfeeding is so important. It's one of those things we call child survival strategies, things uh, that are essential for um, making sure that our children survive, so and that is why we normally like to talk a lot about it. um there are a lot of benefits that come with breastfeeding our children, and for us as pediatricians and for us on Axi Pediatricians Foundation, when you are committed to making sure that our children live and they don't die, one of the things that is very crucial to the survival of our children is breastfeeding, and that's why we talk a lot about it. And I don't want us to feel like, oh, why some others always want to. I think people have stopped doing it, but initially when we started and we talk a lot about breastfeeding, a lot of people feel, I don't know, maybe guilty, or they will try to like, why do you want to make, or maybe they want, it's a reverse psychology, like you are trying to make us feel guilty for not breastfeeding. No, that is not the goal. That's not the goal at all. The goal is not to shame anyone who is not doing breastfeeding or who is not exclusive breastfeeding the baby. Our goal as pediatrician is to tell you this is the best way to feed your baby. Of course, it is not like we are going to take you to court or going to imprison anyone who refuse to breastfeed their babies, but we want to let you know what is the best, of course, and then you can always make your choice when it comes to feeding. But it won't be good for us to know that this is the best way to feed your baby, and we don't tell you about that. So that is why we talk a lot about breastfeeding, and that's why we have this one whole week. The first week of August every year is the World Breastfeeding Week, and so we like to make a lot of noise. We like to talk a lot about breastfeeding during the first week of August, and we've been doing that since the 1st of August till now. The first day we have a lot of breastfeeding videos. There's no reason why any mother should not know how to go about breastfeeding. Global Health Media has released lots of videos that are very simple, very straightforward, to help every mother to understand how to go about breastfeeding successfully. In my own experience, talking to thousands and hundreds of thousands of mothers about breastfeeding, I notice a lot of mothers want to breastfeed actually, but we also have a lot of naysayers, a lot of people who discourage mothers from breastfeeding, and they are always making it look like it's so hard, it's so difficult, and because of that, some mothers kind of give up too early. And that is why people like us exist. People like us are here to encourage you and to support you, to make sure that you are able to breastfeed, exclusively. So that is why we are here. And those videos were produced to make sure that we help you to be able to breastfeed your baby successfully. Okay, so what is breastfeeding? Breastfeeding just means giving your baby breast milk only for the first 6 months of life. We call it exclusive breastfeeding. After 6 months, breast milk is no longer enough, but your baby still need breast milk. So you should keep breastfeeding while you continue to add other food to the breast milk. So breastfeeding, World Health Organization will encourage you to breastfeed your baby for up to 2 years and beyond. So you can breastfeed 2 years, you can breastfeed beyond 2 years. And but for the first 6 months, we want you to give your baby only breast milk. And why is breastfeeding the superior mean or mode of feeding your baby in that first 6 months of life? There are so many things that breast milk does for the baby, for the child, for the mother, you yourself as a mother, for the family, for the entire nation as a whole. So that is why breastfeeding is so important, because it's more than feeding the baby. Okay. Now, every other thing that you can give to your baby, they are just food. But there are other things that your baby will get from breast milk that they cannot get from any other source of feeding that you can give to your baby. So in that first 6 months of life, all the food that the baby needs is in breast milk. The breast milk sugar, the lactose is very easily digestible. There are also protein, there are fats in breast milk, there is water there as well. So you don't even need to give water. So breast milk is both the food and the water combined, all the essential amino acids, all the essential brain, what we call essential fatty acids that are very important for brain development. They are in breast milk. You're not going to get it in other milk. Yeah, I know a lot of, even with the advance of science, with all the technology that all the breast milk substitute manufacturers are using, they are still not getting as close to breast milk. They are only trying. Every year they keep advancing, trying to make it, but there are some things they can never. So we know some of them are not adding DHA, and some of them don't even have that DHA. So breast milk has everything that your baby needs in terms of food for the first 6 months of life. And so that is number one. So even though you can give your baby cow milk and all those other things, those ones can give food, but the way those food are even packaged is not the best. And you can imagine, I mean, the cows don't come to us as human beings to give our to get our milk for our babies. So why should we be getting the cow milk for our own babies when we can give our baby human milk? So Rosemary, thank you for your contribution. Say yes, that's our story. We'll be 8 months this August. We are sucking breast milk and eating other food. We move. Thank you so much. I'm very, very glad to hear that feedback from Rosemary from YouTube. So breastfeeding has all the food in the right proportion, in the right format that is good for your baby. And it's not only good for your baby to grow, but it's also very good for the brain development. And when the World Health Organization do research, we are scientists. We are not just telling you these things based on what we feel. These are everything I'm going to be telling you today. They are evidence based. They are things people have researched. They have published that you can go and find for yourself. So when they do tests and they compare, they find that babies that are exclusively breastfed, number one, they grow better than babies who are on mixed feeding, and their brain, their IQ, is points higher than those babies who are formula fed. That is the truth. So there are things in the breast milk that is good for growth and brain development of babies. That is why we want you to exclusively breastfeed your babies. Another one, which you will never get from any other form of feeding, is the protection. There are lots of things you are passing to your baby that will protect that baby for the first 6 months of life that you will never get from any other food, okay? From formula, all those antibodies, all those what we call immune protective agents, white blood cells, all those things, they are packed in breast milk. Actually, that first milk, that colostrum, is your baby's first immunization. Everything is in the breast milk. So if you don't give your baby that food, so breast milk is more than just food. Now you're actually protecting your baby against germs, against infection. Babies who are breastfed are very unlikely to have diarrhea. They're unlikely to have respiratory tract infection. They are just well, throughout, because you are not just giving your baby food, you're also protecting your baby against infections, against germs, which you will never get in any other formula, no matter how expensive that formula is. Name all those breast milk substitutes, none of them have those antibodies. That is the single most important difference between breast milk and any other form of food that you're going to give your baby. Every other form of food, give your baby food to eat that will make them get big, but it will not protect your baby, protect those babies against infection. And that's why babies that are formula fed, bottle fed, they are prone to having diarrhea, they are prone to having cough and catarrh, they are prone to having all sorts of infections. Whereas your babies on breast milk, nothing like that. Also, your baby on breast milk, you also get what we call some things that protect baby against allergies. There are also what we call the immunoglobulin E. Those ones, they make sure your baby is protected. Whereas babies on cow milk, because all those your formulas, they are based on cow milk. It is cow milk that is just repackaged. Okay, the babies are going to be prone to even what we call cow milk protein allergy, and they are prone to other allergic conditions in future. Okay, so but if your baby's on breast milk, they are protected against allergy. I mean, it's your own milk, so your baby is not going to be allergic to you. So that is another protection that you get from breast milk. So that is number three that I've talked about. And also protection of breast, the protection that baby get from breast milk, it is not only in that first 6 months or the first 1 year of life. In future, babies that are exclusive breastfed, they are protected against all these metabolic disease, diabetes, uh and other what we call metabolic obesity, other metabolic conditions. Babies on breastfeeding are protected against such. And this is again why you need, so you are not only, making sure your baby is getting, being fed, gaining weight. Your baby is not only protected against infections, against allergies. Your baby is also protected even for the future. Their brain development is good, so they're going to be intelligent babies, and also they are protected against obesity, against diabetes mellitus in future. I'm not going to go into why formula fed babies are prone to those things because I don't have much time, but I just want you to understand why it's so important for you to breastfeed your baby. So we talk about things the breast milk can do for your baby. There are many more, but I'm just trying to keep them short. But for yourself as a mother, the more you breastfeed your baby, the more you are protected against breast cancer, you are protected against ovarian cancers. Mothers who breastfeed their babies are protected against cancers. And the longer the breastfeeding, the more protection you get. Also, when you breastfeed, your womb tends to involutes, tend to shrink faster than mothers who are not breastfeeding their baby. So their tummy will go down flatter, and also you tend to shed that fat a lot faster with breastfeeding. I know a lot of mothers sometimes want to overeat because they're breastfeeding. You don't have to overeat because you're breastfeeding. You don't need to eat too much extra food. You need to actually drink a lot more. But you kind of get back, actually your womb, into shape faster if you're breastfeeding. You're also protected against breast cancer. And if you're breastfeeding, especially if you're doing exclusive breastfeeding and doing a lot of the nighttime breastfeeding, you may likely not see your period in that period, in that first 6 months when you're doing exclusive breastfeeding, which means your chances of getting pregnant is also lower. It is not 100%, okay, but it is definitely close to 90%. There's actually no contraceptive that is 100%. But breastfeeding, what we call breastfeeding lactation amenorrhea, it's actually a form of spacing your baby, because you will likely not get pregnant as long as you're doing your exclusive breastfeeding. You're not seeing your period, but because it's not 100%, I always say use other contraceptives to supplement that as well. But these are all protection for you. These are all benefits for you as the mother. And of course, you don't need to stress yourself, okay? You're not boiling water, you're not wasting electricity, you're not doing anything. You can breastfeed your baby anywhere, anytime. Look at our basketballer who just won their fifth championship, the African championship, the Nigerian basketball woman. One of them is, she was there and she was breastfeeding her baby. How awesome is that? And she was still able to play and win goals. So breastfeeding does not stop you from doing anything you want. I mean, if somebody who is playing a championship couldn't be breastfeeding a baby, nothing stops you from breastfeeding your baby as well. I've seen politician women breastfeeding their babies in the House of Parliament and all that. We are doctors, we also breastfeed our babies as well. So there are lots of benefits to breastfeeding, and it saves you money. I mean, every day I see people telling us, see how much this formula is costing, so you better watch it. And I'm like, really? And you don't even need to worry yourself about that, because if you're breastfeeding your baby, you don't need to know how much it costs to buy. And a lot of mothers can't even afford this formula. And it's always painful to me when I see mothers complaining, oh, I can't buy this formula. And so they try to stretch it longer, because for babies whose mom died and we have to give them breast milk substitutes, those breast milk substitutes, you're not going to use them for more than 3 days, 4 days, if you're doing it properly, okay? So you can imagine how many you will buy in a week and how many you will buy in a month. So, and those mothers, because they don't even have that money, they begin to stretch it out, they over dilute it, they are using, and then of course babies are going to be sick, baby are going to. So why do you need to stress yourself? If anything, you should be the one to be doing exclusive breastfeeding. But that's another thing I want to really emphasize, that some people think, oh, it's promoting exclusive breastfeeding is for those of us in the third world. Those of you in Nigeria where you don't have money, that when we go to UK or US of our babies, they actually give us formula. It is wrong. Just, I can tell you for free, okay? Even they in UK, in US, this is not a Nigerian thing. This is the world thing. It's World Breastfeeding Week. I hope you know. It is not like, okay, the American Academy said this or the NHS. Everybody knows, all the pediatrician in the entire world knows that breastfeeding is the best way to feed your baby. Whether your baby is born in the UK, whether your baby is born in the US, whether you're a millionaire or whether you're a thousandaire or you're a hundredaire, it doesn't matter. The best way to feed your baby is to breastfeed your baby. Breast is best. And if you look at every kind of formula, one of the things the World Health Organization has achieved is what we call the marketing. There's a particular code about marketing of breast milk substitutes. And on everything, on every package of any formula, it is clearly written on it that breast milk is the best, because they want you, even as you are going to buy the substitutes, they want you to know that you are going for second best. Why go for second best when you can go for the best? Okay, so breast milk is the best. It doesn't matter which country of the world your baby is born, whether you are born in first world or second world or third world or fifth world, breastfeeding is the best for the baby. It is what Health Organization, it is what UNICEF says, what NHS says, what the American Academy of Pediatrics says. It is what all the pediatricians in the world says. So it is not because we don't have money that we have to go and use breastfeeding. No, breastfeeding is the best for your baby and for you. And of course, to save the country money, it saves everybody because the more we breastfeed our babies, the more our babies will survive, the more our mortality rates will go down, and many babies will survive. At least out of the 5 million children under the age of 5 will die every year in the entire world. If we only breastfeed our babies exclusively, 800,000 of them, nearly 1 million deaths will be averted. So why won't I talk about breastfeeding? Why won't we promote breastfeeding? If we can just get all our mothers to exclusively breastfeed their babies, almost 1 million children will be living and not dead. And most of these children dying, they are dying in Africa, where I'm from. They are dying in Nigeria. So that is why we, more than other people, because we don't even have the health facilities now. Our doctors and nurses on strike. We don't even have all those facilities in the first world. So if they have any issue, they know how to clear around and have the emergency services and all. We don't have that. So we should not even be joking with things that is easy, that is free, that is available, that will cost us nothing. So there's no reason why we should not be breastfeeding our babies. Thank you, Rosemary. I can see how you're supporting you're supporting me in the comment section. Please, other people, let me have your comments. So I've established to us the benefits of breastfeeding. Okay, and now breastfeeding, many mothers want to do breastfeeding. I think that's the impression I get. A lot of mothers want to breastfeed. And in fact, in Nigeria, because one of the questions they asked me on Saturday is why is our breastfeeding rate low? Actually, we do a lot of breastfeeding in Africa, in Nigeria, but most of us don't do it right because we're always giving water. It is that water that spoil everything for us, because if we take away all those people who are, if those people who are giving water, if they stop giving water and just give breast milk only, our exclusive breastfeeding rates can go as high as 80%. But because a lot of our mothers do give water, and I don't understand, I always explain to mothers, breast milk is 70 to 80% water. So get your breast milk, express it, put it in a plain bottle, leave it to stand for one day. I'll just go and look at it. You will see it separate, and you can measure with a ruler how much of it is the plain water, how much of it is the residue that is the milk. You will see that 70% is, you can do that experiment at home yourself. So your breast milk already has enough water. So let's not give our babies water. For the grandmothers, they're always saying, how can somebody eat and not drink? Breast milk is already food and water packed together, because we don't want to stress the mother. We don't want you to start looking for water. And that's what's in this third world. Sometimes we don't even have clean potable water. Some of the water we give to our babies, they are contaminated. So those why some babies have diarrhea from the water. And then some of us, to give this water, you have to give it through bottles. And these bottles, we're not, washing them properly. We're not sterilizing it. That is another way babies get all this infection from. But if you give your baby breast milk directly from your breast, there's no bottle, there's no water needed. And the breast milk is sterile. It's at the right temperature. Just give it straight into the mouth of the baby. You don't even need to wash your breast. Seriously. Just, you can have your bath normally, but each time you want to breastfeed, you don't need to start washing and cleaning. No. Just put the breast in the mouth of the baby. That's all. And so your baby will be able to suck. And they don't need water. Okay? They don't need formula. They don't need agbo. They don't need multivitamins. They don't need any drug. They don't need no drugs. All we want you to give to your baby for the first 6 months is just that breast milk only, and that is it. Okay? And a lot of mothers will say, oh, my breast milk is not coming out. Okay, doctor, I want to breastfeed, but the milk is not flowing. And I always tell mothers, when you have your baby, your milk is only going to flow when your baby starts to suck on the breast. It is the other way around. You are not waiting for the milk to flow. The breast is waiting for your baby to suck. It is the sucking of the baby on the breast that causes what we call the milk letdown. The brain, the way God made our body is so economical, there's no wastage. So when the milk is being produced, it is stored down and it's waiting. But something needs to let the baby, let the breast know that the milk is ready to flow. And that is when the baby is brought to you. And that's why we say the baby must be put on the mother's tummy within the first 1 hour, the first 60 minutes, the baby must be put on breast milk. So all my colleagues and my healthcare professionals, all these ones, our nurses, our midwives, we know it, but I'm going to emphasize it to us. And I want the mothers to know, because I want to empower us as mothers to know, when you have your baby should not be taken away from you. Your baby should be left with you on your body. That is it. All this one, we are rushing to bath baby and rushing to put cream, put powder. I mean, is the baby going for a fashion show? No. All those things are not necessary. Just dry the baby, cover the baby on the mother's chest. Even the vitamin K, everything else we are doing, we should be doing it on the mother's body. Why the baby is on the mother, we shouldn't be separating the baby and the mother. And if you watch our breastfeeding video, that baby will find their way to the breast and start to suck within that 60 minutes. You don't need to press your breast. Is the milk coming out? No. Put the baby to the breast. That is it. Let the baby suck on the breast. It is the sucking of the baby on the breast that will make the milk to flow. Okay, very easy and very straightforward. And of course, sometimes some of us, especially our first-time mothers, we need a little bit of support to help us with the attachment of the baby to breast. All those videos, they're available on our YouTube, on our Facebook group. They're available on YouTube. Just type Global Health Media breastfeeding videos. You will see all of them. It shows you how to attach your baby to the breast. It shows you how to position your baby. It tells you how to keep breast. How do you know your baby is getting enough breast milk? And that first milk that comes out of the baby, please, it is not white. A lot of mothers are actually lactating, but because they don't see white milk, they think, okay, that means I'm not lactating. You are lactating. The milk that comes out first is not white milk. It is colostrum. It can be colorless. It can be what we call amber color, like a little bit of yellowish, not very white. It is not the white, like Snow White's milk, or cream color. No, it is actually a little bit yellowish, a little bit colorless. And sometimes some of you are bringing it out, but you don't know. And that's why some of you wonder, but it's like maybe it's, but some of you don't put the baby to the breast because you are waiting for the white milk to flow. The white milk won't come out until after 3-4 days. So put the baby to the breast and let the baby suck on that breast, okay? And whatever is coming out of that breast, it is enough for that baby. Now, the breast milk operates on the principle of the demand and supply. That is the most important information mothers need to know. A lot of mothers will say, oh, I'm not lactating, so let me supplement. And I'm going to give formula, I'm going to give glucose water, all those things that people give, glucose water, coconut water, all those things you should never give to your babies. Cow milk, goat milk, baboon milk, whatever milk, you should not give to your baby. You should give your baby only your own breast milk. Okay, now when you don't, quote and unquote, I'm not lactating, you start to give your baby all those other things, you are actually going to delay your breastfeeding further. Okay, because breast milk is demand on supply. If there is no demand on the breast will not produce milk. So every time you are giving other things instead of breast milk, you are lowering the demand on the breast milk. And when there's a lower demand, there will be lower supply. And then most of us now get into that vicious circles of being anxious, being worried. I'm not, baby is hungry, baby is going to starve, I'm not lactating. And all the naysayers around you are going to say, people told you, you just give this baby formula, just do this, just do that. No. So which is why I like to have this kind of conversation with the mothers, preferably before we even have a baby, when we're pregnant. And the mother was saying that nobody talked to us about this. It's a failure of our antenatal care if you were not taught about breastfeeding before you have your baby. Our midwives, our nurses, please, these are the things we should be doing during antenatal. It is not the dancing and the singing. Our antenatal should be very focused. Antenatal care is very specific. There are things we should be taking care of during antenatal. Apart from the pregnancy, apart from our tetanus toxoid, apart from taking our food, talking about food and diet, exercise and all that, we should talk about breastfeeding before the mothers have the baby. We should talk about breastfeeding. We should teach mothers how to breastfeed. So if you don't have that conversation during your antenatal, it's a failure of the antenatal care. But that is why we are here, and we are also telling you now. So, and one of the things that normally make me happy is mothers that will say, oh, my first baby, I didn't breastfeed because obviously I didn't have all this information, but now my second baby, I was able to exclusive breastfeed. And you can actually exclusive breastfeed twins. Even twins, and I've seen mothers come to tell us they've exclusive breastfeed twins. It takes a lot of courage, it takes a lot of encouragement, but we are here for you for that. But people can do it, it's possible. And I was telling mothers on Saturday that the most important thing that will guarantee you breastfeeding your baby is you breastfeed from your brain, not from your breast. If you already have the mindset that I can't do it, you won't be able to do it. Because every little challenge you face, you're going to give up. And of course, it's easy for the for neighbors and people to bring the breast milk substitute to you. But if you made up your mind that I can breastfeed my baby, positive mindset, you will do it because you'll be able to follow through and you'll be able to do it. That is the most important thing. Because breastfeeding, believe it or not, is regulated by hormones. And these hormones are produced in our brain. When you are stressed, when you're worried, when you are anxious, you produce what we call stress hormones, cortisol, the rest of them, they are stress hormones. These stress hormones are anti-lactation hormones. So there are hormones that promote breastfeeding, promote breast milk production. There are hormones that work against breast milk production. When you are stressed and anxious and worried, and you will be producing the stress hormones, you will not lactate. But when you are relaxed, you I can breastfeed my baby, I got it, I'm going to do it. You're thinking about your baby is next to you, you're cuddling your baby, you will lactate very well. That is the truth. So that's why most time when mothers come to me and ask a lot of questions, I always tell you, Relax, relax. You can do it. It's so easy. You can breastfeed. Anybody can breastfeed. You were breastfed. Most of us were breastfed. So you can also breastfeed your babies. Okay, you just need the right support, encouragement. Not people who are telling you you can do it. Okay, but if you already made up your mind anyway, before other people come around, you'll be able to do it. Okay, so that is the first thing. Okay, so another thing that mothers have issues with is, oh, my baby is always crying. Oh, that means that means the breast milk is not enough. I always get that information. Mom, breast milk is not enough because baby is crying. Now, let me for bust that myth. Babies cry for everything. Okay, that is the only language they speak in the first few 3 months, 6 months of their life. They don't have a language. The only way baby communicates is cry. So they cry when they are hungry, they cry when they are full, they cry when they're tired, they cry when they want to sleep, they cry when they want to pull, they cry when they want to fast, they cry when they're bored, they cry for everything. Stop using your baby crying as a sign that your baby is not hungry. I don't know why of all the things baby cry for, why we always zero down on hunger. That is not true. Baby's nappy is wet. They're going to cry. The weather is too hot. They're going to cry. The weather is too cold. They're going to cry. They just miss their mother. They just want you to cuddle them. They're going to cry because they know that is the only way they will get attention. And they don't have a way to tell you, I'm crying for food. I'm crying for tired. I'm crying for, I'm too happy. I'm crying for my nappy is wet. That is where we become the detective mother. But please stop thinking every cry is hunger. It is not. That is number one. Number two, babies suck not just because they are hungry. That's another thing. That's all these babies always on the breast. Baby is sucking for 1 hour. That means the breast milk is not enough for them. That means my breast is not enough. No, that is not true. Babies suck for pleasure. Okay, and that's why even your husband sometimes suck breast as well. It is a pleasurable thing for baby to suck. Sometimes they just suck. It's not because they are hungry, they just want to suck. They suck because they know that when they suck, they are close to you. And that's why you see sometimes they're sucking, they will be as if they're slipping off, and they will just hang to the breast and then they just doze off. Because at that time, they are not really sucking because they are hungry. They just want to feel you. They just want to be close to you. They just also want to feel pleasure. We as pediatricians, when we want to do procedure on babies and it is painful, we give them something to suck as a way of anesthesia. That is how we get them to cooperate when we want to take blood sample and all that. So we know baby sucking on something. That's why some people use all these pacifiers. We don't encourage that. Baby suck for many reasons. Everything is not hunger. How do you know your baby is getting enough breast milk? The most objective evidence for us as a pediatrician to know your baby is getting breast milk enough is that they will gain weight. No matter whether the baby suck for 5 minutes, whether the baby suck for 1 hour, whether the baby suck all day or just for 2 seconds, a baby who is getting enough breast milk will gain weight. So that is why each time you come to the pediatrician, we always open your baby on the scale. We want to know baby is getting weight because that is how we know your baby is getting enough breast milk. It is not any of those other things, crying, baby staying 10 hours on the breast. Or no, that is not. It is the weight. And sometimes when mothers complain, we just tell you to sometimes express your breast milk so we can see how much you're producing, because I know it's difficult sometimes to see how much baby is sucking. But let me just let you know that your baby suck more because sucking is an active process more than you can express sometimes. So don't be fooled by, maybe when I express, I can only express 30 minutes. Does that mean that is what my baby is getting? Baby actually gets more than what you can express. Okay, so as long as you are coming to, and usually for the first 3 months, you are going to be coming to us almost every month. So you come at 2 weeks, you come at 6 weeks, you come at 10 weeks. So we always check baby's weight. And each time, if we're checking baby is gaining weight, 30 grams a day for a full-time baby, 20 grams a day for preterm babies, we will know your baby is getting enough breast milk. So don't panic about whether my baby is getting enough. I can't say it. Yes, and it's not about how you feel. So maybe my mother will tell me my baby feel heavy. Of course, when baby has finished feeding, they will feel heavy. When they have when they are about to have their next meal, all those ones have been digested, they will feel light. So we don't rely on your hands, we rely on scale. Scale is the same. It's more objective way. So that is why we rely on that. Another thing mothers always worry about is maybe preferring one breast to the other. You should breastfeed on both breasts. That is why you have two and not one. So, and then let mothers, most of us have either you're right-handed or left-handed. So there's always a particular part that is easier for you to breastfeed from. So don't, some people immediately just pick the baby. It's always like that because that is easier way for them. But be very mindful, if you're breastfed on this side, the next time you should go to the next side. You should always alternate your breast. Okay. I think those are the major issues that I need to address. But if you have any question, I can't see any question yet on Instagram. I can see some comments, very lovely comments. But I just want to make sure I address all the issues. And when you breastfeed your babies, you don't. Some people say, "Oh, because of my health, I cannot breastfeed." There are only very few health conditions in which you cannot breastfeed. HIV is not one of them. HIV mothers, we encourage you to breastfeed your babies. We will give you antiviral drugs. We found out that initially when we started this HIV, prevention of mother to child transmission of HIV, we think, okay, let's not breastfeed because we can pass HIV to the babies through breast milk. Let's give formula. Those are the few exceptions we allow mothers to give formula then. But we actually found out that babies are dying more from the formula feeding rather than from HIV. So we find out that it's actually babies survive better when their mother breastfeed them, even though the mothers are HIV positive, and we give baby drugs for HIV. So it has changed. We actually say breastfeed your babies, even though you have HIV. We will give you drugs, we'll give baby drugs, everybody. And most babies are having, they're still negative and the baby survive. But when we're doing a lot of formula feeding because we think we don't want to give HIV, baby were already dying even before they will have a chance to get HIV. They were dying from diarrhea. Okay. And so apart from mothers who have cancers and who are on drugs for cancer, chemotherapy drugs or radiation therapy, there are those are the major real exception to breastfeeding because those drugs you can't use them and breastfeed. But most of these mothers, I have malaria, I have HIV, I have TB, you can breastfeed your babies. Stop. A mother will say, "Oh, I'm breastfeeding, I'm misfeeding because of my health." If you can breastfeed halfway, you can still breastfeed fully. So it is not a reason. You don't give malaria to your baby through breastfeeding. You don't give typhoid to your baby through breastfeeding. You can only give hepatitis B, HIV, hepatitis C. And like I said, all those conditions have medication. And when we give you medication, your babies will even be protected against those infections. I'm not quite sure whether there's any other part of breastfeeding issue that I need to address. A lot of people ask us whether there are food they should eat in breastfeeding. Thank you, Mary, for your comments. God bless you. I'm doing this as a webinar. I know some people are not online now, but they will come back later and watch it, so it's okay as well. People are asking us, are there food that they can eat that will make breast milk to flow? Honestly, there's no scientific evidence for that. So there are not like some people say, if I take pap or if I eat this particular thing, my milk will flow. But my home personal advice is that if you think you can eat anything and to make your milk flow, why not? You can go ahead and do it, but don't take alcohol, don't take palm wine, don't take anything alcoholic because your baby's brain is still sensitive, it's still developed. We don't want alcohol exposed to the baby's brain. Don't take coffee, don't take caffeine, don't take things that remember that when you're breastfeeding, everything you take can pass through your breast milk to your baby. So you have to be very mindful. Whenever you go to your doctors, you must let them know I am a breastfeeding mother because there are drugs that we should not give you. Before you use any drugs as a breastfeeding mother, please read the leaflets. Read the leaflet. You need to know whether this drug is compatible with breastfeeding. And if it is not, please don't take it. If you are not sure, ask the doctor. Sometimes we as doctor, we have some we are allowed to try some medication because we have to do what we call benefits as with the risk. So we allow, but please make sure first, okay? It has to be the benefit as well the risk. Otherwise, as much as we don't use any drug in breastfeeding, you don't need to use any drugs at all, okay? But if you have any food that you think you eat and helps you, is fine to take. But the most important thing to keep your milk flowing is keep putting that baby to the breast. And we don't put time to it. We don't say breastfeed every 3 hours. You breastfeed whenever baby wants the breast. Just keep giving the baby the breast. Baby have what we call breastfeeding cues. They start opening their mouth. They start using their mouth to search for the breast. I'm sure mothers, you are familiar with that. They start, sucking on their fingers and all that. So when you start seeing those signs, before they even start doing the full cry, they will start all those little signs first. So just put the baby to the breast and breastfeed as often as you like. And when you, yes, another major area which I need to address is going back to work. We as Active Pediatricians Foundation, we recognize it's not easy for mothers to be working and be breastfeeding. Well, let's be honest. And we've been advocating that our mothers should be given that, especially that 6 months when they have to do only breastfeeding. They should be home. They should be on leave. They should be on maternity leave for 6 months with full pay, because mothers need their money as well. So we advocate, and we are grateful to all the states who have uh, endorsed it. Lagos State is one, Kaduna. I think there are about 10 states now. I think Abia State now has joined Enugu, Ekiti, I think Oyo, and the rest of them. So we need more states to join. We need all the uh, private sectors as well. Nestle, Society, there's a bank, Society General, I think, no, not Society General, I'm trying to remember the name, but it starts with an X, I'll remember later. So these are some of the banks that have give their staff 6 months maternity leave. And if your organization is one of them, feel free to mention their names. So that have encouraged. This is very good, because it's so nice when you just know you can carry your baby everywhere, you can breastfeed anywhere, because even the government realize there's no point allowing mothers to come to work and their mind is at home. They are going to be making mistakes. Of course, for mothers that are not given the 6 months maternity leave, there are still ways you can keep exclusive breastfeeding even when you go back to work. You can express your breast milk. And a lot of people are asking about the what's it called, the breast milk pump and all that. These are your best pumps, your hands. You can express your breast milk with your hands. And if you watch that video that we have on breastfeeding video on how to express and store your breast milk, it shows you how to use it. It's a pumping method, and there's a place to put your hand, and how to press release. It's so important for us to get that. So you don't need to look for a pump. If you have money and you buy the electric pump and those very efficient pumps, very nicely. I see a lot of mothers, they just put it through, they are walking and they are just expressing, which is lovely. And you can label it and put it in the fridge. And the people that are helping you with the baby, they can do it for you. But what we really want is for the mothers to have 6 months maternity leave, stay at home. And because it is not just for the mother, it's for the baby, it's for the country, it's for the whole family. So our mothers should be given leave. So please sign our petition to President Tinubu. We've petitioned the President of Nigeria. We've petitioned all the state governors. And so we are happy to those who have already responded, and they've given our abundant 6 month paternity leave. But I want the government, we are starting with government because I want the government to show example. When the government is showing good examples, then the private sectors will join them. So, but we want more people to give their mothers 6 months maternity leave so that they can stay at home and exclusively breastfeed your baby. So when you come off 6 month maternity leave, whenever you are home, you breastfeed. When you are not at home, your baby can take the complementary feeds, and you still work together and you can still express as well. But that 6 months is so easy when you're on maternity leave. But if you're not on maternity leave and you have to go back to work, please, there are ways around it. You can express your breast milk. Breast milk, if you express it and leave it 6 months, 6 hours, nothing will happen to it. So for those who say, I don't have fridge, I don't have this, if you express your breast milk that morning for 6 hours, nothing will happen to it. Okay. But if you put it in the fridge, it can last for 5 days in the fridge. If you put it in the freezer, the freezer that comes with your fridge, it can last for 2 weeks. But if you put it in deep freezer, the freezer that you don't open every day, those deep freezers, it can last for 3 months. So I've seen people who went on calls for 1 month outside the country, And they didn't break exclusive breastfeeding because they've expressed enough and store it in the freezer to last for 1 month. It is possible. All these things are possible. It's a matter of, are you willing to do it or not? So that's what you, or you can make sure you go. One of the things we also advocate is that even in our places of work, they should have creches where mothers can go and breastfeed their babies when they're on break, or you can use a crèche close to your work. So you should have regular breaks to go and breastfeed your babies and you come back. Okay. So when I was working I was a resident doctor when I had my first two babies in Luth. So we have that um crash within the hospital. So I express and I also go and breastfeed my baby. So sometimes if sometimes you're working, you're so busy and you completely forgot you have a baby, and then they just call you, okay, breast milk has finished, yeah, come. Then you quickly take a break, you go and breastfeed your babies. And I know a lot of my friends did the same. So we're able to exclusive breastfeed our babies, even as doctors work in the hospital, because we have a crash in the hospital where we can go and breastfeed our babies during our break, or even if they call us. I know everybody will know that you have a baby, so they will allow you to have that break. And it just, again, like we say, if we can get the 6 month maternity leave, but then I think they gave us 4 months maternity. So it just those remaining 2 months for the remaining 6 months exclusive breastfeeding. And after exclusive breastfeeding, baby can have other food anyway. So the breastfeeding is also part of it, but at least you have more freedom. Okay, so I think that is all I'm going to say. So again, this year our team is prioritize breastfeeding and create system. Breastfeeding is not just for the mothers, it is something we all have to contribute. So I'm doing my part by giving you this education. I want the president of Nigeria to support our governors, our leaders, support us to make breastfeeding leave for mothers 6 months with full pay. We should let our mothers, because what they are doing is ministry, is God's work for the entire nation. Because the way you know how great a nation will be is how we treat our youngest children. Okay, so I just say I would, before I round off, I want to do our breastfeeding quiz, because a lot of people were asking about some of the breast. And number one, I'm so impressed about how many people did the breastfeeding quiz. I mean, it's so impressive. So many people did the breastfeeding quiz. So, we're just quickly going to mark it. Okay, I want to make it smaller. I want to make it smaller. Okay, yeah. So I don't know. Okay, maybe I should make it a whole screen so it will be bigger. Yeah. So a lot of people were asking us about the breastfeeding quiz. How soon should breastfeeding begin after birth? It's 60 minutes. Okay. A lot of people were thinking it's 30 minutes. Actually, 60 minutes. You should breastfeed within 60 minutes. Baby should be breastfed. The answer is on demand. Okay. So on demand, day and night. The third question is, breast milk is ideal for food for newborns and infant because all of the above. Really, it contains all the nutrients, it contains antibodies, it's available, it's affordable, it's all of the above. And number four, say the benefit of breastfeeding for the mother included of the following, except lactation amenorrhea is one of the benefits. Reduces risk of breast cancer is one of the benefits. Reduces risk of ovarian cancer is one of them. Increases chances of type 2 diabetes. Of course, no, that is the answer, because the answer is except. So it does not increase the chances of type 2. It actually reduces the chances of type 2, and it prevents postpartum depression. That's also true. When you breastfeed your baby, you are unlikely to have postpartum depression. And number five, say the following is true in terms of long-term benefit of breastfeeding. The answer is breastfed babies perform better in intelligence tests. All the other ones are actually the opposite. And then the difference between formula and breast milk is the antibodies. So that is the C, the presence of antibodies in breast milk. All the formula, no matter how expensive they are, they don't have antibodies. And then another number 7 say the disadvantages of formula feeding, except, always remember the except. That's where some of you get it wrong. So higher risks of diarrhea, yes, That is one of the things you get with formula. Presence of bacteria in formula powder, very unlikely. At least NAFDAC and the rest will make sure that they don't have the whatever they are going to sell in the market is not contaminated. But then the baby can still have the malnutrition because of trying to stretch the breast milk, and they can also have respiratory infection is common in formula fed babies. So but presence of bacteria is not likely one of them. And concerning HIV and breastfeeding, the following is true. Yeah, HIV mothers should not breastfeed. No, that is not true. They should breastfeed actually. Breast milk substitutes like formula are the best option. That is not true. In the olden days, yes, but now we find out that it's actually best for them to breastfeed their babies. HIV mothers can breastfeed as long as they are taking their medications, and that is a true answer. The international code to regulate marketing of breast milk substitutes is 1981. So that's that one. That code is to regulate marketing of breast milk. Calls for the following except no prescription. So we as health professional, we can prescribe breast milk substitutes if the breast milk. Sometimes that's why people will ask us if you are promoting breast milk. Why are there see people making formula and all the rest? Because sometimes there is no mother. Sometimes mothers died, and sometimes maybe someone got some metabolic disorders that they can't even take breast milk. Very rare in of metabolism, but there are a few scenarios where babies have to take the second best and there's no alternative to breast milk, so we have to give them breast milk substitutes. Those are the exception, they are not the rule. So the way some of us do it is the other way around. Now we now think formula is the rule, then breastfeeding if you can. No, we should all be breastfeeding our babies, but if a mother died, and we used to do a lot of work nursing and people helping mothers, breast milk bank. I think we are going back to them now, but because of the HIV thing and other, we kind of soft pedal on them. But I think these days people are actually going back to breast milk bank as well, but that is the other options. But sometimes because of those kind of scenario that we have formula. The following practices are not subject of new mothers. Okay, rooming in is a good practice. So babies should stay with their mothers if you want them to breastfeed. Use of newborn nursery is not good. We don't want babies taken to the nurseries, private hospitals. Let the babies stay with their mother. Stop taking them to nursery, except a baby who is sick. But otherwise, baby should stay with their mother. Separation of mother and baby. Supplementation with infant formula. So rooming in is the correct answer, is the except kind of a question. Facilities that support breastfeeding. In those days when I was growing up, we had what we call the baby friendly hospital initiative. It seems to have died down. I think UNICEF started it in the 1980s. We need to wake it up again. Those days people would display that they are a baby friendly hospital, at the front of the hospital entrance. So, but these days it seems like nobody cares anymore. But this is what we should be promoting. Every health facility should be baby friendly. I was in a hospital to have one of my babies, and they are not baby friendly, even though there's a hospital that has pediatricians, because they separated my baby from me, and I have to tell them, you need to give me my baby now. And when they were going to be dilly-dally, I have to tell them, go and tell your consultant that I am a pediatrician and I want my baby now. So then they quickly brought my baby to me because they realized that I know what I'm talking about. So we call them baby-friendly hospital initiative. Practices that support breastfeeding mothers returning to work. Paid maternity leave is true. Except this is an except question. Terminating appointment of breastfeeding mother, that's not fair because and schools, I think I should be calling out schools. Actually, private schools, they do this a lot. Once they know that a mother is going to have a baby, then they want to start, we should stop it. All those babies are our babies, they're all our children. So we should be supporting our mothers, our teachers. We should be allowing them to have maternity leave 6 months, and we should not be sacking them because they are going back to work. Or we can have creches that is manned by a trained nurse or midwife, so that the mothers can have break and breastfeed their babies. After all, it's just 8 to 2 or 8 to 3. Most of them are in the school anyway. So we should have facilities for mothers to express and store their breast milk as well. So the answer to that one is facilities, practices that support breastfeeding, except is terminating appointment of breastfeeding mothers. When should babies on exclusive breastfeeding be commenced on solid? It is 6 months. I get a lot of questions saying my baby is 5 months now. Can I say no? You already know the answer. Why are you asking? If you have done 5 months, please do the remaining 1 month. The grace that carried you for 5 months will carry you for 6 months. Stop asking them. Maybe you'll be 6 months in 2 days or 3 days. Can I start now? No. The answer, even if you ask us, maybe it'll be 6 months tomorrow, it's still going to be wait until that tomorrow. So there's no point to be asking us. Some mothers are always so eager. There's no hurry to start complementary feeding. There is a scientific evidence why we pick 6 months. I don't have time to go into all that, but there are everything we recommend. For us as pediatricians, we practice what we call evidence-based medicine. We don't just do things because the spirit is leading us to pick 6 months. There is a reason why we pick 6 months. That is when the baby's digestive system and all that are able to handle it. So please wait for 6 months. Do your exclusive breastfeeding for 6 months, then start complementary feeding. Even if you can't do exclusive breastfeeding, don't give solid. Start formula. If you cannot do exclusive breastfeeding, because like I said, we are not going to take you to court if you don't do exclusive breastfeeding. But if you're not going to do exclusive, go to formula. Don't do solid until 6 months, please. The following are position for breastfeeding: football hold is true, cradle hold is true, sideline, all of the above actually are true. The following states is the first to introduce space 6 months maternity. That is Lagos State, our state of excellence. So this is Lagos State. The most common cause of cracked nipples is actually poor attachment of the baby to the breast. So that is it. And a baby properly attached to the breast, we have the answer is the last one, the whole of the nipple and almost all of the areola. This is where mothers get it wrong. Sometimes we just put I see a lot of mothers breastfeeding and it's just the nipple in the mouth of the baby. That is not right. It has to be the nipple and the areola. That black part beyond the nipple, they all have to be inside the mouth. Okay, the following is correct about storage of breast milk, except, so I've already answered this one. Fridge is 5 days, it's not 24 hours. If you keep your baby's breast, if you express breast milk, label it, the quantity the baby can finish, that's what you should be expressing per container, and you label it so that you will always know. If you keep it in the fridge, it's 5 days. And some people say you can actually buy ice block for if you're going to a crèche where they don't have fridge, buy ice pack. The way they bring those immunization, just put it around it to still last, for that day at least. The first type of breast milk is colostrum. That is the B. The following are myths related to breastfeeding. Breastfeeding should be dropping the height of the baby. That is a myth. Please, breast milk is not an eye drop. It is food. Stop putting food in your baby's eyes. Okay, breastfeeding baby lying down will lead to ear infection. That is not true. That is a myth. You can breastfeed your baby lying down. Just know how to do it. If you don't know how to do it, sit up and breastfeed. You can do breastfeed any way you like, but it does not cause ear infection. Many of you don't know how to do it. That's why you think it will cause ear infection. Breastfeeding mother may not have a menstrual bleed. That is actually true. As long as you're breastfeeding, you may not see your period. So that is not a myth. Breast milk will go sour. That's another thing. Mother says, if I travel and I don't breastfeed for 2 days, then the breast milk is going to go sour in my breast. It's not true. As long as that milk is in your breast and you have not expressed it out, it doesn't go sour. So you can always resume breastfeeding when you're back. The anti-infective things present in the breast milk, except is red blood cell. Red blood cells is not, that is blood. A red blood is not in the breast milk, but white blood cells and every other thing else is there. What is the minimum duration of breastfeeding recommended by WHO? Is 2 years, 24 months. We want you to breastfeed your for 2 years and above. Please do it. The hormones that are involved in breast milk production is, except cortisol is anti-breast milk production, but prolactin, oxytocin, yeah, they are involved in breast milk production and lactation. Methods that can increase breast milk supply include it is sleeping and resting. So every other thing like taking palm wine, alcoholic drink, please don't. Use sugar, no. Lactation medication, we don't recommend any of those, but rest and breastfeed your baby. That is it. The following is true of breastfeeding mothers and medication. I think I've mentioned that already. You can just use anti-malaria if you have symptoms. No, you can't just use medication at all when you're breastfeeding, except a doctor has prescribed it. Stop self-medicate. I know it's something we do a lot, which is wrong, really. But when you are pregnant and breastfeeding, don't self-medicate, because it's not just about you alone now. We're talking about the baby. So remember to read all your drug leaflet. That is the last one that is covered. What is the theme for this year's breastfeeding week? It is prioritize breastfeeding and create sustainable support systems. So that's the one. Winnie, what are the simple things for Winnie? Except wear firm bra is good. You can wear firm bra. You can use analgesic for pain. You can use cold or warm compress for your engorged breast. You should wean when your baby is sick. Please don't wean babies when they are sick. I see a lot of mothers using opportunistic weaning, but you should plan weaning your babies. And there are times we don't recommend. When your baby is not yet established on complementary feeding, that's not the time to wean. When your baby is sick, that's not the time to wean. But if your baby is fine, baby is eating complementary feeds well and all that, then you can begin to do what we call gradual weaning. You can afford take away breastfeeding in the morning, then you take away breastfeeding morning and afternoon. Then the night one is always the last one to go. And sometimes you may want to do a crisis on where you just take baby to grandma for 2 days and baby hopefully will forget. But just make sure you're emotionally ready, because I find a lot of mothers are not emotionally ready, because when they now say they've stopped breastfeeding, maybe cry 1 day or 2 days, they are going to go back to breastfeeding. It's okay, baby is going to cry no matter how slowly you do it anyway. But if you've made up your mind, you're going to endure together for the last 2-3 days, and then baby will forget about breastfeeding. And once you stop breastfeeding, your breast milk production will stop, and hopefully in a few weeks your breast will completely dry off. Breastfeeding is absolutely contraindicated. Absolute contraindication in breastfeeding is actually rare. So the few occasions I've mentioned it already is mothers who are on chemotherapy drugs for cancers. And I even see mothers who decide that they are going to suspend their chemotherapy and just breastfeed. But it is one of those exceptions. When a mother is on chemotherapy, we don't want you to breastfeed at all. Or radiation therapy, no breastfeeding. What is exclusive breastfeeding? I think everybody know that one. So it should be breast milk only, no water, no formula, no medication. It does not mean that you cannot use medication if your doctor prescribed it, but no medication that is not prescribed by your doctor. All right, so I think I have one question, and I've taken about 7 extra minutes, but I'll soon be going, don't worry. Can you take fruits while you're breastfeeding? Yes, you can take all the fruits. You can take all the veggies. There's no contraindication to that. Okay, I really appreciate this talk. Thank you, Mary. And so this talk will be available on our YouTube. It will be available. Facebook do take down our live videos after 1 month now, but it will be available on all our podcasts and every other channel. So even if you can't get it on Facebook Live, but it will be available on our other platforms for you to watch afterwards. So what can you do to help blocked breast ducts? Okay, your breast duct number one should not be blocked, but I know what you meant. So sometimes, because mothers sometimes don't we don't um we don't attach our baby to the breast well, and we're not breastfeeding, we tend to have what we call engorged breasts. Okay, and so the breast will become so hard, and it's really not the best for us as well, because it's painful and it's so hard and it's very painful, and it can actually get infected, lead to what we call mastitis, or even sometimes breast milk abscess. So the way to do it, actually, to prevent your breast engorged or to prevent block, is actually to make sure your baby is sucking on the breast. And that sucking, it has to be the baby sucking with the whole of the nipple and the areola in the mouth of the baby. Because if your baby is sucking on the nipple, the milk is not flowing out. I don't have my model here, but the breast, if you cut open your breast, there are milk ducts, which you are talking about. There are about 20 of them. They run through the breast, and then they have a dilated portion towards the end underneath the areola, what we call the breast, the milk sinuses or the milk bank. That is where they store the milk. So when your baby is sucking on the nipple, nothing is flowing out, because it is that areola part that the baby needs to suck on, because that is where the milk is stored. That is where the milk sinuses or the milk banks are. So when baby suck on that, the milk. So when you press that part of your breast, you will see your milk gushing out like tap. Okay, so that is the part where your baby needs to be sucking on. So as long as baby sucks on that, the milk will flow. So if you already got to the stage where your milk is already so as congealed together, what you need to do, you can use warm compress. So you put a little bit of towel in a little bit of hot water, warm water, not hot like boiling, scalding hot, but something you can actually put your hand inside, squeeze it out, and just put it on your breast. That will kind of help to melt and make the milk to flow. But the most important thing is the baby sucking on that breast. When the baby suck, the baby will drain out everything and then the milk will flow. But if your breast is already painful and it's hot and red, when you touch it, it's hot and it's red, that means already infected. You will need antibiotics, you will need painkillers, and you have to see your doctors for that. And then they can give you antibiotics, and then that will clear that. But as long as the baby is sucking on the breast, your milk, your breast to flow. Usually, first time mothers struggle because they are learning to breastfeed, and baby is a little bit hard. Sometimes painful. Sometimes breastfeeding should not be painful, but most times when the baby suck on the nipple and nothing flows through the mouth of the baby, then the baby will try to. Why is this milk not coming out? Then they bite on the nipple, and then the mother feels pain. Everybody's then it becomes a vicious cycle. So that is why getting that attachment of the baby to the breast is the most important thing. I always say latching of the baby to the breast is 98% of the breastfeeding. Once you get the baby to latch properly to the breast, your breastfeeding will be easy and smooth. And so most time babies rush to grab the breast. They don't always get it right because they always grab on the nipple. So what you normally need to do is that make sure your baby's mouth is open wide, and then you push almost the whole of the breast in their mouth. That is how to get this. If baby is trying, just make sure the way to do, you can put your finger in their mouth like this, that's what we call the roosting reflex. They will open their mouth, or you can actually depress them, with your little finger, you put it in their mouth, it will depress the mouth, then you can put the whole of the breast in the mouth. That way you get it right. Once you get that right, breastfeeding is actually very easy, but that first few days getting it right, we just need to help our new mothers to get it, and once they get it right, they'll be fine. And you can eat anything you like. I love the fact that somebody is asking questions. There's nothing anything you are not allergic to, you can eat. Apart, of course, we don't want to take alcohol, we don't want to take caffeine, but any normal food, fruits or vegetables or water, you can take those ones. There's no particular food you have to eat to breastfeed. You can eat whatever you like, but please eat moderately. Don't overeat. And a lot of mothers will say, when I breastfeed, I feel faint. I feel like, please eat. When you are breastfeeding, don't try to lose weight. I know, because I've been there myself. All of us are always trying to lose weight because after having a baby, we're still, we've gained some weight, and obviously we want to lose the weight. But don't try and do it when you are still breastfeeding. For breastfeeding, exercise, drink a lot of water, moderate diet, but don't go fasting, don't go taking all these weight loss supplement. Don't do that when you're still breastfeeding. When you are done with breastfeeding, you can start your weight loss strategies. You will get there, but please not when you are breastfeeding. Okay, I need to go now, but I think people are now getting. I'm not getting questions. Can breastfeeding also prevent from pregnancy from someone seeing her menses? Breastfeeding, if you are not seeing your period, can prevent pregnancy, but it is not 100%. It is not. It is not. Some mothers do it and they get away with it, but it is not 100%. So don't come and say, "Oh, it is Dr. Gwemi that told you if you breastfeed, you will not get pregnant." It's 98%. So please do additional contraceptives. So whether your husband is going to use condom, or whether you're going to get the injections, or whether you're going to take an implant, or whether you're going to use a diaphragm, or whether you're going to use a female condom, or you're going to use what other method, IUCD, whatever method, the coil. But breastfeeding can prevent pregnancy, but it is not 100%. So we always recommend you use additional uh, um, methods. And if you're already seeing your period, you are not covered. You must not be seeing your period, because the idea is that when you're lactating a lot, your what we call the progesterone is a little bit high, so it's kind of make it difficult for your for you to see your period and all that. So, and it also prevents ovulation and all that. So, but once you start seeing your period, the chances that you're ovulating already, and then you can get pregnant. And sometimes you can actually ovulate without seeing your period as well. So please, please and please just do family planning, especially because a lot of mothers always come to our group and always ask, it's not breastfeeding related, but since you're asking, I think I should mention it. A lot of people will come and say, oh, I'm pregnant. And the way people ask that question, they always ask surprised, and I'm always surprised that they are surprised because pregnancy is never an accident. That is the truth. Pregnancy is not an accident. Certain things have to happen before you get pregnant. Okay, you've had sex. Okay, that is it. And you have sex when you are not using any form of protection against pregnancy. That is it. So you're a mom of childbearing age, you are not menopausal, you have sex, you're going to get pregnant. It's as simple as that. So there's nothing to be surprised about pregnancy, okay? So if you don't want to have pregnancy, then you have to protect against pregnancy. And it's either you stay away from having coitus or you use contraceptive. Of course, if you're a married woman, you want to have your normal interaction. So just do family planning and then you'll be fine. So that is that. Somebody is asking what causes breast milk coming out after 50 weeks of weaning. If you're still seeing breast milk, that is not breastfeeding. That is what we call galactoria. It's a sign of your prolactin level is high. So that is what it means. If you're not breastfeeding and you are seeing breast milk, that means something is wrong. Your prolactin level is high. You have what we call hyperprolactinemia. So you have to see your gynecologist. They will check the blood level of your prolactin. If it's high, there are drugs they can give you to bring it down lower. And especially if you are trying to conceive, you better see them fast because that can prevent you from having a new baby. So if you are trying to conceive and your breast is bringing out milk and you are not breastfeeding, you need to see a gynecologist to treat the hyperprolactinemia. One last question. Take a contraceptive pill. How? That's a very lovely question. Yes. So, because I see a lot of mother has this question, especially on our adult groups. When you are breastfeeding, you can't just use any form of contraceptives. Okay. There are contraceptives that are compatible with breastfeeding, and when it comes to contraceptive pills, it has to be progesterone only contraceptive pills, mini pills, POP, whatever name they call it. But some of us, before we got pregnant, before we had our baby, we're using the combined contraceptive pills. The combined contraceptive pills has both the estrogen and the progesterone together. You should not use that when when you are breastfeeding. So when you're breastfeeding, no combined contraceptive pills. If you want to use contraceptive pills that is hormonal, it has to be progesterone only. Anyway, they should ask you when you go to buy it, but sometimes if you go and buy it yourself and you don't tell them, they may not know. But please, if you're breastfeeding, don't use combined contraceptive, which is again why I stress the fact that anything you're going to take, any tablet you're going to take, when you are breastfeeding, please read leaflets. If you read your information leaflet, they would have told you, if you buy the combined one, they would have told you don't use it in breastfeeding. So if you are breastfeeding and you want to use contraceptive pills, use only progesterone only contraceptive pills, mini pills. That's the name for it. Okay, you can use the progesterone injections, the 2 months injection, the 3 months injection. You can use the implants. You can use IUCD. All those ones are compatible with breastfeeding. You can use condom. Okay, the only one that is not compatible with breastfeeding is anything that has estrogen. You cannot use it with you cannot use it when you're breastfeeding. Don't use it at all. Okay. All right. I think we've gone past time, but I'm happy for all the questions coming out because today is the last day of the breastfeeding week, and I hope we'll be able to create more awareness. I hope we'll be able to encourage you to prioritize breastfeeding. Please, we are always here for you. If you want to breastfeed your baby, we are here to support you. Nothing gives me more joy than to see people saying because of you on ATP, I was able to exclusively breastfeed my babies. I love that testimony all the time because I'm so happy that it shows that a lot more people would have been able to breastfeed exclusively if they get that support. But the reason why people are not getting that support, I mean, why people are not exclusive breast because they're not getting that support. Then I have final good news is that when I was doing the webinar for the Pediatric Association of Nigeria on Saturday, I was with another colleague who actually run a breastfeeding support for mothers, and they have a hotline. So I was so happy. That's Dr. Lope. She actually runs a hotline for mothers. So I'm going to share that line for you now. They call it Breastfeeding Club. They are on Instagram, and they have a hotline. So let me look for the hotline and share with us. So if you are trying to breastfeed or your sister is trying to breastfeed and they are getting frustrated or anything like that, please give them this number. It is a breastfeeding hotline. Let me see if I can copy it. Oh no. Okay. Just a minute. I need to copy it. So I said I'm going to share it. Copy. Okay, I've copied. Okay. So please give them this number to call. And they're on WhatsApp. So which means that if you send them this number on WhatsApp, Instagram people, let me share with you as well. So Instagram people is even easier for you because they are on Instagram as well. So that is the Breastfeeding Club, and they run a hotline. In other words, if you are struggling with breastfeeding and you need help, how do I do it? There's now help. Okay. Before we used to talk about sick lactation consultants, and many people are like, "Oh, do we have lactation consultants in Nigeria?" Yes, we do now. So this is a number for them. So call them and they will support you with breastfeeding, with getting you through that early phase. So if you are struggling with breastfeeding, you need help, that's the hotline to call. We in ATP, we don't run a hotline. If you post your question, we will answer you, but of course we may not answer you like within quickly. It may take us 24 hours sometimes, but we try our best to answer you. But if you want to talk to one-on-one, somebody you have practical issues with the breastfeeding and you want support, so there's a breastfeeding hotline now. I think that's the addition for this year. So you can call that hotline and then they will be able to provide you that support with breastfeeding. So you have no excuse for not breastfeeding. We are here to support you. We are here to encourage you, and we will support you all the way. And you can do it. I trust you can do it, and you can always breastfeed your baby. So thank you so much for everyone who have listened, and for those who are going to come and listen after I'm no longer online. If you still have any questions, feel free to post your questions on our Facebook group. See, next year when we come again to celebrate another World Breastfeeding Week, keep breastfeeding your baby. Keep encouraging other mothers to breastfeed. Don't be one of those people who are always discouraging mothers from breastfeeding. So I want you to be part and parcel of this promotion of breastfeeding. Encourage mothers, breastfeed, encourage others to breastfeed, tell them about the benefits. And if you have any questions, feel free to post it on Ask the Pediatricians Facebook group, and we'll be there to support you. So have a wonderful evening, and it is bye from me. Bye bye.